everyone, we're going to get started. My name is Samantha Andrews. I'm the training manager at CACA. Today, we're going to be presenting on turning trends, local data, and stories into action. I want to go over some housekeeping before we get started. If you have any questions, you could enter into the Q&A box or you could put it in the chat. Just make sure when you enter into the chat, you put it to everyone so they all can receive the questions. We are recording this and we'll be posting this to CACA's website in the coming days. I'll put that link in the chat box as well. And I will also be putting the evaluation link in the chat box. So if you have time after this, please take our evaluation. We have two speakers with us today. One is Christina Clark, one of our CACA trainers, and Sue Thal, one of our public policy consultants. So if you have any questions, please let me know, but otherwise I'm ready to get started.
Thank you so much, Samantha. Hi, everyone. Christina Clark, as Samantha said, and I'm going to be tackling the first part of our workshop today, which is about combating trends. Chris, next slide. So what do we mean by combating trends? And this is where I've seen so many friendly faces in the chat. So many of you heard me say kind of my soapbox that if we're waiting for our student survey data to tell us something, we have waited too long. And so how do we make sure we're staying on top of the trends and really getting the data and building the partnerships we need to make really great decisions about policy at a local level, as well as other interventions that we could be making. Next slide. So why are we here today? As I mentioned, we're going to be talking about those historical trends we've seen in the past and how coalitions have been able to intervene early to make real impact on a local level and then assist on the national level with seeing some change. We're going to talk about how do we do this in a way that we're not adding more to our to-do list. The prior executive director of a coalition, I know how busy each and every one of you are. So how do we weave this into the work that we're already doing so that we're smarter, faster? And then finally, how can we uncover some potential partnerships and develop communication channels? So again, this data collection and staying on top of trends isn't just resting on the shoulders of our coalition staff members. Next slide. So a little history lesson, just to go through some of the things we've seen in the last few years. Many of you, all of you should be familiar with the prescription and the opioid issues we've seen. And a lot of times we kind of get stuck in thinking that these trends just happen overnight. And so this really shows that it doesn't, that we can get ahead of them if we're staying on top of it, right? So we're looking at prescription opioids. Yes, they were around before 1995, fully realize that. But this is when the Sackler family first started marketing for general pain, right? And so that's when we started to see it more mainstream. And then in 1999, we started to see that uptick in opioid overdose related deaths. Synthetic marijuana, we tackled that a lot in Tennessee, and we're going to use that example coming up. Then 2004-05 is when that was created. It was marketed in 2008, and then there's a national ban in 2011. Vaping, which so many of you are tackling. 2006 is when it was introduced to US. 2008, the World Health Org says not a suitable smoking cessation device, which all of us already knew. And then in 2009, we see it bans and controls again. And then on the recent developments we've seen over the last few years is around Delta-8. And what's interesting, like I said, is that this didn't happen overnight. We saw that research begin in 1974. And in 2018 is when we started to see the impact because of the Farm Bill. So the reason I bring this up is not because you need to know the history of all of this, but it's to say to you that we can get ahead of this. That when we look back, this isn't something that just happened overnight. It just shows up and is suddenly an issue. There is a long track record and history of stuff going on. And if we know about it early enough, we can intervene before we start seeing the major issues like a rise in overdose deaths in our area. And so that's why waiting until we're seeing that or getting a student survey data saying an uptick isn't making us smarter, faster. We need to be looking at this qualitative data, this local level conversations and storytelling so we can get ahead of this sooner. Next slide. And this takes us back to primary prevention. The idea that what our role is to get ahead of this. We want to stop people before they fall in the stream of substance use or any other unhealthy behaviors. We want to get ahead of it and put those guardrails up, those protective factors, those policies or interventions in place that make it harder for them to get to these substances. And the only way we can do that is by figuring out it's happening sooner. And so we need to get ahead of that curve. If we're going to have that environmental change, we're making sure that beautiful frog, which represents all of our children and families, are in a community that's safe and healthy. We have to get ahead of this sooner. We've seen it work really, really well, and we have to get better at that, about systematizing, making sure that we're always looking at the newest data, that we're talking to people in our community, that we really have a pulse of the changes happening so that we can stay ahead of them. Next slide. So here's an example of that. And again, this is going back to the 3 waves of the rise in opioid deaths. And you see it starts back in 1999. Then we see a rise in heroin deaths in 2010, and then again in 2013. I see this as multiple ways we could be intervening as preventionists. Thinking back to the coalition I worked for and what we were seeing in Tennessee at the time is that we were strategic prevention framework state incentive grantees in our area of the coalition that I was running at the time. And prescription drugs weren't on the radar at all, right? We were working on alcohol, tobacco. Prescription drugs weren't even being looked at. And we started to hear stories because, again, we're going to talk about storytelling. We were coming to coalition meetings, asking what people were seeing, having conversations. And it started with a simple conversation in early 2007 that we had a bus driver who was a fan favorite of everyone in the community, who was now struggling with a prescription drug issue directly related to opioids. And in those conversations and people just feeling like they could talk to us, we started to hear more of this. And then we started to pull data. We started talking to the school systems and pulling suspension and expulsion data. And with that, we found that 66% of the kids that were getting in trouble, either expelled or suspended, were doing so because they were sharing prescription drugs in school. And again, this was before it was on any student survey, before we were seeing any major opioid deaths in our area. And so we petitioned the state at the time to put in some student survey data questions around prescription drugs, and they just couldn't do it fast enough. They didn't have the funding. So we took it into our own hands and started doing the focus groups and asking. We actually applied for the drug-free communities grant in the 08-09 era, and were able to get it funded for prescription drugs and start to do real work at the community level. We were able to intervene quickly and talk about safe practices, have drop boxes before most people in the country did. We were able to bring in our medical professionals, start counseling on proper prescription drug practices, even building relationships with pharmacists before the prescription drug monitoring system to let us know how many pills were being prescribed out of our local pharmacy. And that all happened before we saw national bans, before we saw that national prescription drug prescribing system. And it was all because we had these partnerships and started uncovering this data. And it allowed us to have new policies at the school system level. And it even allowed us to intervene at a local level with pain clinics, which we saw a rise of at the time as well. And so it all comes back to, if we hadn't been listening, we hadn't been getting that local qualitative data, we wouldn't have been intervening this well into 2012, 2015 era instead of in 2009. And I will say the work we did, we know had impact, because in 2013, we won the Got Outcomes Award for CADCA for our ability to reduce substance use among that 12 to 24 population with opioids. And so this can be done and done well. We just need to be getting those stories from our community. Next slide. Another example of this comes from the great state of Wisconsin, with one of our master trainers, Dorothy Cheney, really piloted with her people, and she really helped me put this together because they've done great work here. It's another example of when we stay ahead of something, what it can look like and how it can impact other states and then the nation. They really started to see Delta-8 popping up in all of their stores. So they did a statewide environmental scan where they're looking at youth over 18 are buying and legaling it and selling it to other youth. Must be 21 to buy vape and nicotine products, but 18 to buy Delta-8. In one of their towns of 20,000, law enforcement reported in a night shift 12 encounters with youth on Delta-8. Some stores were selling gummies and other candies products in bulk with handwritten labels, so just absolutely no policy or control. And then some reports of Delta-8 in the front of the store. They were also selling Delta-9, so our classic street marijuana, out of the back of that store. And so by doing this, by seeing young people starting to use this, we're seeing it popping up in stores and saying, okay, let's all get together and see what this looks like on a statewide level. They're able to uncover all of these different holes. You can see right now that policies could be put into place and interventions could happen just by doing environmental scans. Next slide. So how do we do this? How do we make those two things we see in Wisconsin and Tennessee happen in our communities? And I'm going to go through each one of these more. But build trust with coalition members and partners. They have to be able to trust you to tell their stories. Collect qualitative data routinely, everything from storytelling to listening sessions, environmental scans, and partner data sources. And again, I'll go over each one of these in more detail. Let the data dictate next steps. And then, of course, communicate with other coalitions as well as state and federal partners and funders on what we're uncovering as we do it. Next slide. So first, how do we build trust? If we want someone's stories, they have to trust us with them. If we had not built that trust for a community member to come to us and say that bus driver was struggling with a prescription drug substance problem, we would have never started to unpack what we were starting to see with opioids in our community. Someone had to trust us first. And how do we build that trust? And I often say, it's like we don't normally propose to someone on the first date. I mean, some of us, I think my father did to my mother, but we're not all like that. Most of us work up to that, right? We need a few dates in between. It's the same way when we're building trust with partners. We're not going to go out and ask, please tell me intimate details of substance use in your family on the first date, right? We need to work up to that. And so I love using the partnership continuum, the idea of thinking through this in yourselves of where for each one of my integral partners for the coalition, where do we fit into this continuum and how do I take it to the next level? So coordination is that we're just starting to get friends phase. You know, we've maybe been on a coffee date, they've come to a coalition meeting, but we're not like full on yet, right? We're feeling each other out. Cooperation is we're starting to do stuff. We went to their health fair. They came to our meeting and said they volunteer at something. And then we get to collaboration. We're like, we can do something together. We can take this to the next level. And then finally to partnership. How can we share resources and really share funding to take it to the next level? And like I said, it's okay if you have partners in all different levels. You should, because you should be continuing to build capacity. The idea of this is if you take this back is to say, okay, where are we with our law enforcement? And how can we take it from coordination and cooperation? Where are we with our school system? How do we take it to a partnership level? Because the better we get at this, it makes the rest of our work much easier. Because then the school system comes to you and says, hey, we're just seeing a major uptick in these things happening, or we're having this mental health problem. And then law enforcement's coming to you, and it makes your job so much easier. And so starting here, that capacity piece of how do we build real relationships and where are we with each partner is really important, and being really strategic, say, how do we take it to the next level? Next slide. So most important, and I feel like this is an old golden rule, but we forget it, is say what you mean and mean what you say. If we say we're going to do something, show up and do it. You say we're going to be involved with them, let's be involved with them. So just making sure that we're true to our word is so important when we talk about our partnerships and building those really strong partnerships and moving through those phases of moving from coordination to cooperation and so forth. Part of our job as coalition members, and we talk about this a lot with building capacity, is being a safe place. Everyone should be able to come and feel open and like their word is okay and whatever they say is okay, and that they are going to be held accountable too. You're going to be held accountable. They're going to be held accountable for whatever work is supposed to get done. But we have to build that environment of trust in it so that we're going to do something about it and that people feel open enough to have these conversations. It's not easy for someone to talk about some of these emerging trends. A lot of times it was parents coming to me, telling me things that were happening with their young people, with their family. And so we have to keep that sacred until they're ready to share it and help them find that voice and moving forward. We have to be fair, make sure we're allowing everyone to talk in coalition meetings, that it's not just about someone with a title, whether it's a school administrator or your chief of police, that a parent's voice is just as important as someone with a title attached to it, because 9 times out of 10, especially when we're looking at this community level and telling someone's story, it's going to be coming from those parents. It's going to be coming from those young people. It's going to be coming from someone who isn't standing by their title, but is standing by a personal experience. And so we need to be open and fair, make sure everyone's heard with that. And also remember that all partnerships are different, and that's okay. That we're allowed to have one person in that coordination phase and another one in that partnership phase. And it's just about us building that and being truthful. Next slide. So build trust with coalition members for data sharing. This is what we're getting at, right? We want to make sure that people will trust us with the data and how we share it. And good qualitative data collection is really, really hard, like I said, without trust. People are not going to share their personal stories with you. They're not going to feel comfortable telling you what happened in the school yesterday. If it's a school resource officer, they don't feel like they can trust you with how that data is going to be used. So one of the first things we need to do is be really clear about how data will be collected and used. If we're collecting their stories, like we're doing key informant interviews with a lot of school resource officers or any type of law enforcement or medical professionals, we let them know how and when it will be utilized. Whether you're putting it on your logic model or you are going to put it in the paper, or before you do put it in the paper, getting their approval, having that communication is really important to continue that trust. Again, don't propose on the first date. Don't ask for all the data. It should be something you're working up to, or letting them at least know it's something you're working up to when we're talking about having that conversation about data. And sometimes it is archival data and they're prepared to give that, but for more background and to get that really good qualitative piece, it's going to be something that takes a little more time. And if and when data is released, again, make sure you get feedback from your partners. If you're putting it in an op-ed piece, if you're talking in front of local legislators or your board of aldermen or whatever it is, that you're making sure your partners know they're going to be speaking on those data points. Next slide. Storytelling, which is my favorite. I don't think it gets any better than when we're able to tell our stories and our community's stories. And we need these people, and we need, they're the ones who know what's happening. They have their pulse on everything happening in the community. He said this doesn't happen overnight. This is something that doesn't just poof, synthetic marijuana is all over your community. It's little things happening and trickling in. And the sooner we can find out, the better. And that happens through storytelling. And again, it's as simple as asking your coalition members what they're seeing and hearing. I used to start every coalition meeting with, what's going on? What are you guys seeing? Getting them into smaller groups, talking about it. And you would see fantastic things come out of just people commuting and telling their stories of what they're seeing. Also, I know all of our trainers say this, but make sure you're meeting with your partners more than just at your coalition meeting. Have coffee meetups. I've got more out of making sure I hit all my major partners every 6 months with a coffee date than I ever did out of them coming to a coalition meeting. So making sure you have those routine touch-ins. Pinpoint key coalition members to engage in conversations and ask members about meeting about other things that they're hearing or seeing. So have them do it. It's not just about coalition staff, but find your social butterflies, find the people that really like having these conversations. Be like, hey, can you meet with your other friends? When you go to church, can you ask and hear what they're seeing? When you go to work tomorrow as a pharmacist at Walgreens, do you mind touching in with some of the farm techs and seeing what they're hearing and seeing? It's a ripple effect of getting people's stories and bringing it back to you. As I mentioned, opening with even 5 minutes on let's get some feedback on what we hear or see, what are trends you see from partners, finding some way to integrate on a regular basis, getting feedback is really important. And making sure this is informal, that we're thinking about like a friendship. We don't want it to always seem like a very structured focus group. This is truly about getting people's stories and staying on top of trends by using those. So just make it like a friendship. That's really what we're trying to do. Next slide. One of my favorites is listening sessions for data collection. Again, we're talking about qualitative, so this is not perfect in any perfect world, but it's our way of a touchstone about what's happening. And a listening session is a little easier than what we see with a focus group, right? Where we go to define questions. It's about getting that feedback, where we can have a facilitated discussion with getting information from whether it's youth at a town hall meeting, or we go into the school lunchroom and have a conversation with young people, or we meet everyone over lunch and touch base. Again, listening sessions for me are that, how do we stay on the pulse? How do we ask them the questions about what's happening, have the conversations and build the relationship? Much less formal than a focus group when we do a survey, but just as important in getting the context we want in terms of data and stories. Next slide. Again, you're using the stories as a guide for listening sessions. And it's not just for youth. I think a lot of times when we start to talk about listening sessions, it's youth, which are so important and we should, but you can also do it with parents, medical professionals, store owners. One of our best ones that we did was listening sessions with medical professionals, and we had dentists, doctors, nurses, pharmacists, all come at different times and have conversations around what was happening around opioids and prescription drugs, what they were seeing. And because they got so comfortable and they were with their peers, the information we got was incredible and allowed us to have better data and come up with better interventions and policies. Make sure you're getting specific as you're asking questions. Ask when they're seeing use, where they're seeing it, why they think it's happening. Each question can uncover other nuggets. And that's why I love listening sessions, because it is more informal, where you can start kind of uncovering and unraveling, taking apart that onion of issues. And then, of course, if you were ever like, I don't know how to do this and I'm scared, connect with CADCA. Talk to your local evaluator. Make sure you're connecting with someone who can help you with this, because you have people right here who could get you the assistance you need to get it done. Next slide. My favorite, and should be one of yours, is environmental scans. I'm going to tell you why I love them. Because your community loves them. If you have people in your coalition who's like, when are we going to get work done, Christina? I'm sick of talking about the problem. I want to get something done. Get them to do environmental scans. Because not only do you get data, but they get to see the real issue on the ground level. Okay. And this is also where a lot of times you're already doing this for things like alcohol and tobacco. So with emerging trends, you can keep doing that and then leave its end. So this could be done to examine practices of local businesses, but also it could be done to look at advertisements in the marijuana space, anything like that. Look at number of prevention messagings, all of those things. There's many different ways to use an environmental scan. Next slide. So thinking through, again, alcohol, synthetic marijuana, tobacco, Delta-8. It collects vital information on price, how it's being promoted, costs, types of product being sold. Again, this is where you can have your community members go where they get their gas, where they pick up their meds and go ahead and do one of these scans for you. Again, it allows them to see what's happening and feel like they're getting work done. And you can also utilize this from everything from social media, do social media environmental scans, to retail stores, to medical professional offices. Like I said, one of our most successful environmental scans was when we started looking at pain clinics. It was before they were being really policed and making sure policies were in place. So they were popping up everywhere. And so you couldn't tell what was a pain clinic and maybe what was actually a real medical clinic. And so by doing scans, we were able to really pinpoint those and help with policies. So it can be used in a lot of different ways, not just with alcohol and tobacco. Next slide. So again, this shouldn't be you. Looking at you, coalition leaders, doing this by yourself. This is about getting your committee together and having them help you do this. Figuring out how many retailers you have, how many medical professional practices you have, whatever it is, and being like, okay, where do you go to work? Where do you go to the doctor? And having them help you do this. Develop that coalition sign-up sheet and have them, provide them with talking points, provide them with the sheets to do it, but allow them to go out and do this research themselves. Give them both written and electronic. I don't know about you, but my coalition, it depends on who they are. Some people want to be pen to paper type of people. Other people want a survey monkey, making sure you have both so that you can get as many people participating as possible. And then remember that it's okay to have them, and you should have them go to different locations at different times a day. Like I said, with our pain clinic scan, we did them 3 different times a day, morning, afternoon, and night, and even tracked who was in the parking lot in terms of states and license plates. Fine. Again, making sure you're involving your partners. I think a lot of times we kind of get tunnel vision and thinking we know exactly what we want. We should go with that, but they also are collecting a lot more data that you have no idea about. I would have never known that my school system was actually tracking data on suspensions and explosives related to prescription drug sharing in school if I hadn't asked. I would have just assumed, because what we had been getting historically was only on tobacco, alcohol, and marijuana. And by saying, hey, we're trying to track trends, we're seeing this, they pulled that up and we didn't even know they were tracking it, and allowed us to then be like, what else is happening that we don't know is going on? And so making sure that you're asking for the other data collected, work with your court system on getting even on the docket list. I'm still to this day, because I just never got removed, on the docket list for the court system I worked in. It seems silly, but you're able to see a lot of what's being prosecuted, what are people being arrested for, what's the follow-up, and we would actually track every DUI, every major infraction around marijuana, and everything in our community, simply from being on the docket list. Again, ask school system about the data they're collecting on alcohol, drug offenses, suspensions, and expulsions. Again, not on the first time you meet with them. This is going to be something they're going to work up to and have to trust you with that information. And then work with law enforcement on crime mapping to pinpoint drug trends. This is something that we worked really hard in, and one of the things we were able to support is a tip line. And in supporting that tip line with the contract that we have with our 3 law enforcement was allowing us the data from the crime mapping system that came with the tip line. So it really allowed us to see where is social hosting happening, where are the major places getting in trouble for selling to minors in terms of retailers. It really opened up the doors for us and being able to pinpoint interventions and also policy changes on a local level for a very specific area, whether it's this city or county level, based on what we're able to find through the crime mapping system. Next slide. Let the data dictate the next step. So if you need to ask more questions based on what you uncovered, collect additional data points. Like I said, for us, we heard about young people sharing prescription drugs in school. We went and then did a focus group. Why are they sharing? What kind of drugs are they sharing? Because at the time, we didn't know exactly what they were sharing. What's happening in terms of mental health there. And this allowed us then, for our student survey that we had developed, to even add more mental health questions, to be very specific about asking about what type of prescription drugs young people were using. Because even when our state jumped on it, they only asked prescription drugs generally. And the survey we developed asked, are you using anxiety meds? Are you using pain relievers? Are you using depression? Are you using ADHD meds? So we could really pinpoint what was happening. Do you have more information on when and where substance use is happening? Again, nailing it down on a local level and using it to help address those gaps in policies and education. And then how will you get this information out and who needs to hear about it? So after you put this all together, who do we need to have this conversation with? Do we need to go to the school board meeting? Do we need to be talking to the commissioner, police, etc.? I remember when we first started doing this work around opioids in our community, my police chief came to me, one of my still favorite people to this day, and said, I'm so ready to be proactive instead of reactive. How can I help after I gave him this information? He's like, we can do something about this if we work together. This really allowed him to see where the coalition could be pivotal in the work he was doing. Yes, you have to build these partnerships to get this data, but then once you do and they see the way you're using it, it builds lifetime partnerships of people realizing when we come together, we're better together. And then that allows them from the Pharmacists Association helping us out because they saw what was happening to the law enforcement, both the Sheriff's Association and the Chief of Police Association helping us do this work after we did it on a local level, on a state level, because they saw the impact. So your investment can triple if you do this really well. Next slide. Again, I often say we always think about policy as like top down or bottom up. And the way I like to see it is more like an engine where we're going back and forth. We need to be giving this information to our federal and state partners. CADCA needs to know what's happening so that then they can be like, okay, what can we do on the national level to start this? Again, if we're able to curb this, I think back to synthetic marijuana in Tennessee, and immediately a small coalition banned it in their area. Once they got that ordinance, it started to trickle out and it went across the state. Then we need to make sure we're communicating with the states next to us. Like I said, Wisconsin told Tennessee what they were doing with Delta-8, we were allowed to replicate it. And if we're making sure we're having that constant communication, we're able to hit it in both directions. We're able to make sure we're making these really great local level policy changes while also informing national legislation. If we just wait for the national to happen, we're going to be too far deep on the local level. So we really need that back and forth. Next slide. So again, I just want to take a moment to talk about weaving this into your current work, because I completely understand how much you have on you. And I understand we have funder regulations and all of that, but we can really make this happen as part of our capacity piece and as part of the data we're already collecting. So if you're already looking at alcohol and alcohol sales, add Delta-8 to that environmental scan you were already going to do, or add the tobacco, or add the synthetic marijuana, whatever is being sold in those markets that you're already going to collect data at, just add this as a new line. Make sure you develop teams or committee. This is all about structure to help research locations and assist with facilitating with scans or listening sessions. They want this information too. This is a great way to get people in doing the work. So making sure you find some way to help get people to help you do it and build that infrastructure is important. As you're uncovering this, you're going to probably need to recruit or expand partnerships. When we first got that information back in 07, 08, we didn't have very many medical professionals at the table. I think we had a few nurses, but we didn't have prescribers. We didn't have pharmacists at the table. And immediately we're like, we have to build our medical professional partnerships. And so that was a huge pivot for us. And so as stuff happens, of course, new partnerships will need to be developed. People need to be recruited. And the first way to do that is to come to them and say, I want to listen to you. What are you seeing? And having those listening sessions and really getting those stories from them. And as you're pulling data for your grants that you already have to pull, whether it's from your school system or from law enforcement, going ahead and asking for any trend data at the same time. As you're asking for those arrests for minors and possessions, be like, hey, have you seen any other trends as you've been arresting, or with school resource officers? Have you seen any other trends? And as you've been helping students in the school system, going ahead and doing it at the same time that you're collecting data that you know you need for your grants, ask some of that trend data as well. Next slide. So some key takeaways are, remember, it's part of our job to uncover these quickly. As preventionists, we have to get ahead of the game. We have to make sure we're unpacking it early and we're seeing what's happening. And the only way we can do that is by having our hand on the pulse, right? We need to be talking to people in our community. And the best way to do that is in qualitative data. We will be behind if we're always waiting for student survey data. I'm not saying it's not important, but we'll be behind if we're waiting for it to show up every 2 years in student survey data. Use quantitative data from partners to back what you're seeing in those listening sessions. So again, as we're hearing that kids were sharing, as we were hearing that we were seeing opioid use happen in our community, we could back it with what the suspicion expulsion data said. We start backing it with the amount of prescriptions we saw coming out of our pharmacies at the time. You can do both at the same time. And remember, this should be fun. And coalition members love to do this. They want to be the detectives in their community. Open it up and allow them to be part of it at every stage is going to be really important to our work. Thank you so much. And with that, we'll take it and shift it over to what we could do with policies and thinking as we uncover these emerging trends. Sue?
Hi, everybody. So Chris, stay on this slide for a minute. I just want to thank Christina. I loved your presentation. Every time we train anybody in policy, the most important thing that you can do is be data-driven and data-based. And really, because all politics is local, the closer that data is to the local level, if you're trying to make change on the local level, or the state level, if you're trying to make change on the state level, the better. And in all honesty, even in Washington, D.C., all politics is local. The way to get anything done at the national level is to go to elected officials with the information from their congressional districts and their states. They are the most interested in what's going on in the communities they represent to the people that actually vote for them. So I want to say, I think everything Christina said is critically important to be able to get the information, the data, the trends, the stories together, because it really is taking the data, turning them into an anecdote that puts a face on the data, explains exactly what's going on, and figuring out what your ask is and of whom. And so basically that's what I want to be talking about, is sort of how to turn the trends that Christina was talking about and that local data into policy change and policy action. And I'm going to be using Delta-8 as sort of the case study example of how to do that, because it's an emerging trend that's more than emerged, but it's really a problem everywhere. And it's a really interesting one because, as you'll see in a minute, some states actually have banned it. Some communities have actually themselves tried to ban it or do cease and desist around it. But although the DEA says that it's not legal at the federal level, there's still gigantic loopholes here. And so it's a really interesting one to do some case study analysis on, using the tips and the tools and the data and all the information that Christina raised on how would you do this? If you're going to really do something on Delta-8, how would you go about doing it? So Chris, if you can give me the next slide, that would be great. So this is a really interesting one. Why do we have a problem with Delta-8? Well, it's because the federal law changed as far as hemp and what the definition was of hemp. And the Farm Bill had an unintended consequence. This was supposed to help farmers be able to, you know, have a new industry in farming and to use hemp for everything. And then there was a gigantic glut in the market with hemp. And these people were stuck with all of this stuff that they didn't really know what to do with. So what did they end up doing? They ended up actually using CBD derived from hemp to make Delta-8. So now all of a sudden we have this unintended consequence of a farm bill where we have a new psychoactive substance that is being produced and sold. It's the fastest growing segment of the marijuana market, and it's a legal gray area. Delta-8 THC products are actually not subject to the same regulations, taxes as Delta-9 THC in states that they have either legalized or have medical marijuana, and it's a gray area at the federal level. So just an interesting thing here that unintended consequences of policy changes matter. And this is one where a federal law changed, and the unintended consequences that every community in America in every state is dealing with a Delta-8 crisis. So next slide, please. So what's the problem with Delta-8? Well, there's a gigantic oversupply of CBD in the US. Delta-8 is really harmful to the developing brain. It's very similar to Delta-9 THC. And as Christina explained, people who are doing their environmental scans are seeing this pop up in gas stations, in convenience stores, in tobacco shops, in CBD shops. This is on the internet, and I'll get to that in a minute. These products do produce euphoric effects that are very, very similar to Delta-9 THC. And there's almost no regulatory oversight whatsoever. And a lot of this actually contains many other compounds, some of which are extremely harmful and poisonous. Next slide, please. So there's also a number of products that are saying that they're Delta-8 that actually have 10 times the legal limit for Delta-9 THC. A lot of the Delta-8 has copper, chromium, nickel, things that are, really poisonous and should not be ingested into human bodies. And Delta-8 THC is being called the bathtub gin of the marijuana world. It could also include lead. Now, why am I saying all of this? Because we need to be aware of these issues and in general understand what these substances are, what they contain, how they're made. All of that is incredibly important. But when it comes to policy change, we really have to take this down to the local level and the state level and explain how and why this is a problem at the state and local level using a lot of the tools and techniques Christina talked about. So next slide, please. So again, there are adverse health effects of Delta-8. I don't really want to go through all of this, but obviously you need to do your homework on a substance in general and get as much information as you can about it to use in your advocacy so that when you go in and make your case, you are more than educated and able to answer any questions that might come up. Now, next slide, please. So how do people get Delta-8 products? You can get them online and at convenience stores, gas stations, smoke shops, head shops, t-shirt shops. And this is where you get into what Christina was talking about with doing your environmental scans, with doing photo voice, with getting everyone in the community involved in going and buying these things, taking pictures of them, finding out where they're being sold, whether people are carting, because it's not regulated. There's no age limit on a lot of this stuff, getting your youth involved and figuring out how youth are accessing and through whom, how much you think they're using, the types of effects. All of the stuff Christina talked about is incredibly important to do through your coalition if you want to make any policy change at the local or state level about Delta-8. Next slide, please. So here are just examples of scans that people have sent us from around the country so that we can share things with our members across the country of what's being sold. So drip, drip, earth green apple. Keep going, next slide, Chris. No, go back. I want to show people a little bit more. So this is, Granddaddy Burp, 1 gram, Delta-8, the way it's packaged, looks like a vape pen. This is from Michigan. Next slide, please. This is from Wisconsin, so you can have sleep gummies that are not even packaged in any way with any information that tells you what's in them, what they are, to ointments, to creams. Next slide, please. 92% Delta-8 Empire. This is obviously from New York, CBD.com. This one says must be 21 or older, don't operate equipment. But then did anyone selling this ever check an ID? I don't know. This is the type of stuff you need to find out during your environmental scale, and then going in and doing what we do with shoulder taps and other things for alcohol. We need to be doing it for these as well, and then document what's going on. Are 12-year-olds going in and being able to buy this at gas stations? Well, we need to figure that out. Next slide, please. More, this is Arkansas, Twisted Margarita, maximum strength. I don't know who they're appealing to. The magic cookies. Now here again, we get into the same issue that we have with edibles for THC. Would a child understand that this wasn't really a cookie and that they shouldn't be eating it? And are we ending up with poison control issues because of Delta-8? Another thing that we need to be looking at. Next slide, please. This is a picture that I actually took myself. I was walking down the block on vacation in Fort Lauderdale, Florida, and this is Delta-8 THC sold here with the marijuana leaf. Of course, this isn't supposed to be THC. And it was a t-shirt shop. It wasn't even really a head shop, but everybody walking down the block saw this. And I actually went in with a friend of mine's grandchild who's 12, and they were able to buy Delta-8 THC. So this is the type of stuff that I think all of us really need to use Christina's tips, tools, and all of the information she gave to be able to actually show what's really going on the ground with these new and emerging substances that are ubiquitous. They're really a problem. Next slide, please. So you have to decide, what do you want to change regarding Delta-8 THC? So do you want to change a law? A number of states actually have banned it, and we'll show you that in a minute. Do you want to regulate this, so that do this through a regulatory agency, which is part of the executive branch? Do you want to change a policy? Do you want to get funding to raise awareness about Delta-8? Do you want to work with law enforcement? And you'll see in the example that we're going to show in a minute, to do cease and desist orders about it. You have to decide what you want to change so that you know who to go to be able to make the case that you need the change. And to do all this, you need to have all of the information at your fingertips to make the case that there's a problem that needs to be addressed through some sort of a policy change. Next slide, please. So you have to decide who has the power to make the change that you want. So identify what system. If you want to ban Delta-8 at the state level, then it would be the state legislature, and you need to do the state legislative process. If you want to do something at the local level through an ordinance, then obviously you need to go to your local county elected officials. If it's more enforcement that you want, You need to go to police. So you really need to figure out who has the power to help you make the change, identify what system you can make the change through, and then what people in the system have the power to help you make that change. So next slide, please. So fully understand the process you want to use to make the change. This is obviously the legislative process at the federal level, but every state has a little bit of a different legislative process. There are some state legislatures that are full-time, some only meet for 3 months a year, some meet less than that. So you really need to understand the process that you want to use to make the change and have a very, very clear ask. What is it you want to change? Do you want to make it so that Delta-8 is illegal to sell? Do you want it regulated? Do you want much more enforcement? What is it? And then who do you need to work with to get what you need? Next slide, please. So as of August 2021, 18 states actually have banned or restricted Delta-8, and here is the list of those states. Now, obviously, if 18 states have banned or restricted, the other states, we still have room to do a lot of work in those. So hopefully we are working in other states to actually ban Delta-8. Next slide, please, Chris. So why was the change needed? Advocates were able to document the extent of the problem with Delta-8 using facts, figures, anecdotes, and stories, the types of pictures of the products, who was buying them, how kids were accessing and using them, the types of problems that people were experiencing because of Delta-8. And then depending on the state or the coalitions, they educated their legislators if they were able to get the state legislature to pass a law to ban this based on the harms posed by Delta-8, the fact that it's, you know, it's really very dangerous, or they educated their state agency rulemakers who are in the executive branch, again, on the harms of Delta-8 and why it needed to be regulated. So in the states that have done something on Delta-8, some of them have done it through the state legislature and made it illegal. Others have done it through a regulatory process in the state to try to actually regulate it. So next slide, please. So who's the case made to? So coalitions band together in a lot of states with law enforcement and other partners, very similar to Christina explained. Who are your partners and how do you get them involved and why should they care to make the case for statewide legislation? Or they went to the executive branch and made the case to state regulatory agencies that they need to propose rules to be able to limit the sale and regulate Delta-8. So depending on what change you were trying to make, you made it to different people, but it was the same case. This is dangerous. We don't really know all of the effects of this, but we know that it's harmful, that the way that it's made is not regulated, and it is very harmful, like THC, to the developing brain. Next slide, please. So the reasons that some of the states banned Delta-8 were New York banned it for safety and mislabeling concerns. So obviously we needed to have people who were taking the Delta-8, buying it, and then taking it to labs to see what was actually in it and whether what was on a label matched what actually was in it. And obviously there were tremendous mislabeling concerns as far as the content, the THC or CBD content, whether there was THC that wasn't supposed to be in it, the metals, the chromium, the lead, all of that other stuff. So in New York, people got together and really went to the state and said, hey, this stuff is unsafe and it's being mislabeled and we need to stop it, we need to ban it. Vermont banned it because synthetic cannabinoids can't be used in hemp or hemp-infused products according to state law. So they actually already had a law on the books that they knew about, and they were able to go in and convince the legislature that it was illegal in Vermont. Colorado banned it because it includes toxic and harmful substances in the products, as we just talked about. To be able to do that, you have to actually test the products to see what's in them. And coalitions can band together and actually work with law enforcement and other partners in the state to actually get this tested and raise awareness about the fact that there's a lot of toxic and harmful components in Delta-8. And Kentucky banned it because Delta-8 products do not contain compounds naturally extracted from the hemp plant, and because they contain traces of harmful chemicals. So the reasons that these were banned were things that coalitions working with other partners were able to get the information on by doing exactly what Christina said, getting the products, testing them, and then sharing the results with the proper people who have the power to make the decisions to ban or very highly regulate Delta-8. Next slide, please, Chris. So how did the states do this? Some state legislatures well, passed laws, and in some states, they used the agency and rulemaking process in the executive branch. I said that before. So Colorado's legislature passed a bill. New York's Cannabis Control Board actually published regulations on Delta-8. Vermont's Agency of Agriculture, Food and Markets did a proposed rulemaking. Kentucky's Department of Agriculture wrote a letter advising the shops to stop selling Delta-8 products because it was illegal. So I'm putting this slide in to go back to the original slide, which is you have to know sort of who has the power to make the change. And that's the system that you need to work with. And that's where you need to find the people to make your case too. And you need to do it if you're going to do anything on a statewide basis, working in partnership with all of the other coalitions, law enforcement, parents and teachers group, medical societies, and other people of like mind who are going to help you get to the right people to make your case to get a policy change in place. Next slide, please. So this is a local Delta-8 case study from Smithville, Missouri. These guys were inundated with Delta-8. And they really are a case study for Christina because they did a lot of exactly what you explained in your slides, okay? They start by buying these products from the gas stations and the convenience stores and the t-shirt shops and the pop-ups in the mall and every place else. And they actually took them to a lab and they had them tested. And one of the products actually had 4% THC. These are not supposed to have THC in them. And they compiled all of their findings and all of the stuff that they collected from all of the environmental scans, from working with youth and law enforcement, and put them into a report with their findings, but also all of the information, the pictures and other information that they had collected from working in their community. Next slide, please. How'd they make their case? Well, they did an educational webinar about Delta-8 with a psychiatrist and an organic chemist, as well as other speakers. So this is something else that Christina talked about. Really, you need to start by raising awareness in the community with all of your other partners and unlikely allies, parents, teachers, schools, everybody that has any interest in youth and how they're accessing and using these products. So they raised awareness with Scale and Scope and did a webinar, and then they collected all of these Delta-8 products, took pictures of the ones that were being sold, involved youth in collecting and speaking about the information, how kids are accessing, what percentage, anything, because it's such a new and emerging thing that you necessarily have school survey data on, but that doesn't mean that you actually can't do the type of analysis that Christina was talking about and build this from the bottom up by doing your scans and working with everyone in the community. Next slide, please. So what did they achieve? They informed their local prosecutors in the Missouri Department of Health and Human Services about the fact that they tested these products, that they actually had a lot of THC in them, all kinds of harmful metals and other things. They had a really good relationship with the mayor and the aldermen, and they got their support. And a lot of this was going in with like-minded partners from the coalition to make the case. And then the county prosecuting attorney worked with law enforcement agencies to actually put together and issue cease and desist letters to all of the businesses in this town that were selling or distributing Delta-8 products. Next slide, please. And this is actually the letter. And it basically says that they're going to fine people up to $20,000 per offense, or double the amount of any money gained from the offense, and that all sales must cease and desist. And it's signed by the prosecuting attorney in Clay County, Missouri, Daniel White. And this was hand delivered to every one of the distributing and dispensing places that they had found in the town. Next slide, please. So what were their results? 2 of the 4 businesses stopped selling Delta-8 products entirely. The third plastered their store with signs saying that Delta-8 were only for people aged 21 and over, and did start carding and making sure that they were doing that